food induced, so it's caused by eating something. Enterocolitis means your gut lining, and syndrome means that there's a huge spectrum of what you can see. For some people, it can be mild, and for some people, it can be severe, and it's a little bit unpredictable, and we can delve more into that, but that's like the big gist. So it's basically a digestive reaction to a food. The tricky part about it, unlike peanut allergies that you were alluding to, is that it's not immediate. I would say the biggest, most common symptom is vomiting. And it's not just one vomit, it's not just like two vomits, it's like continuous episode after episode. Like you think you're done and then it can keep going.
That could be obviously the reason why we see delays, because it can mimic other things that can happen commonly in children, like you said, like a stomach virus, or like, sometimes kids vomit when they're trying new foods because it elicits the gag reflex, or it's reflux if a child had reflux in infancy. So Taylor, I am going to jump to you. I'm curious, like how it presented, and it could have presented differently in the two children that had it.
With my daughter, because it was delayed, it actually happened like at night. And so by the time I got into her room, she had already thrown up. But with my son, when he trialed the food, this is actually a funny story. So it was 4 hours. And in my head, I was like, if we make it to the 4-hour mark, like we're probably good. And so my husband had him in his arm and was like, yay, and was like dancing up and down, like we made it. And as he was doing that, he like projectile vomited and it launched out of his mouth.
Welcome back to the podcast. If you are tuning in, you are watching this on our YouTube channel, please make sure to subscribe and also comment on these videos to make this channel grow. I cannot stress this enough. This is so important so we continue to bring you amazing guests and conversations on the podcast and on our channel here. And today I'm thrilled to welcome two incredible guests on the podcast, Dr. Taylor Arnold and Dr. Manisha Relan. Dr. Taylor is a registered dietitian and the creator of Growing Intuitive Eaters, who's passionate about helping families foster healthy relationships with food and navigate mealtime challenges with confidence. Joining us also is Dr. Manisha Relan, a board-certified allergist and immunologist who specializes in food allergies, FPIES, and immune-related conditions. Together, they are going to bring a wealth of professional expertise and personal insights to help families understand FPIES. Thank you so much for joining me today, Dr. Taylor and Dr. Relan.
Thank you.
It's a pleasure.
Yeah, excited.
I am loving this three-prong approach. So I asked my followers what they wanted to hear, what they felt like I needed to have on my podcast, and an overwhelming response was FPIES. And I don't blame them because it is something that we've been seeing. I see a lot. A lot might be a relative term, but more than I think people may realize. And a lot of my families, the number one thing when they are diagnosed or going through the challenges are, I feel so alone. I feel like nobody else talks about this. I don't know anybody who has it. So I just am really excited that we're going to be able to talk about it from a general pediatrician approach, but also allergy, immunology, and nutrition. And Taylor, before I go to Manisha, tell us more about your experience with FPIES, not only in your career, but also personally as well.
Okay, so I had 3 kids, or I have 3 kids. They're 2, 4, and 6, and my oldest 2 had FPIES. They've since grown out of it, but I'm also really passionate about food allergies, and it's kind of like I was like thrown into this world in the personal space too, having 2 kids with FPIES. So, it surprised me. And my oldest was actually misdiagnosed and we didn't catch it right away. So I think that's, just goes to say how hard it is to identify, and even for someone who is a professional like myself.
Well, I hope in the conversation we can get into more of that in terms of, also I'm curious as a general pediatrician what it was mistaken as, because I have a feeling I know, but I will ask that later. And then Manisha, tell me your experience with, obviously FPIES and obviously the work that you do.
Mm-hmm. Yeah, FPIES is like an integral part of allergy immunology fellowship training. We have done challenges during our training. We diagnose, we manage, we treat, and we also cheer the patients on when they outgrow it. So kind of like the full spectrum of it all.
Yeah. And, the point of this conversation, like I said, is to really bring home all different aspects of where a family may end up going if they are diagnosed with FPIES or going through the diagnosis process. Like you said, Taylor, that sometimes it's not so clear cut. So Manisha, I wanted to first ask you some questions. Can you explain to parents what FPIES is, what it stands for, and how it differs from a typical food allergy. Like, for example, someone may see like, they eat some peanut butter and they get hives or, swelling in the face, how it differs from that.
Yeah, absolutely. Very important. FPIES is a very long word. It's food protein induced enterocolitis syndrome. So it's a mouthful. And I try to tell parents, let's break it down. Food induced. So it's caused by eating something. Enterocolitis means your gut lining, and syndrome means that there's a huge spectrum of what you can see. For some people, it can be mild, and for some people, it can be severe. And it's a little bit unpredictable, and we can delve more into that, but that's like the big gist. So it's basically a digestive reaction to a food. The tricky part about it, unlike peanut allergies that you were alluding to, is that it's not immediate. So your child eats the food, or you, because adults can have it too. So it can present in anywhere from infants all the way to adulthood. Very common in children, younger children under the age of 3. I would say infants are diagnosed between 1 to 4 weeks after they've been introduced to cow's milk or soy protein. I would say that solid foods, when your child or baby is eating, when you begin to introduce like solid foods, so between 4 to 7 months is like a common time the symptoms may present. And then unfortunately and thankfully rare at the same time, in children and in adults, it can happen, and we can go into which foods trigger it. I don't want to monopolize the whole conversation, but there's a lot to say. So needless to say, the symptoms develop hours after you eat the food. So this is very different than a peanut allergy.
Yeah, I love that you have a lot to say, and that's exactly why I wanted this conversation. So it's okay to have a lot to say. But why is it that the FPI reaction may take hours to appear instead of being immediate? Maybe, obviously, people listening may not always be medical trained here, but can you explain kind of like how that would work differently than another allergy?
Yep. And my simple answer, because I can go a lot into science, we can go into the weeds, but my simple answer is that it depends on what kind of immune system cell we activate. So I talk about the immune system very broadly. It's like our defense system. And just like in our national defense system, we have different levels. We have the military, we have the Navy, we have all of the different like Air Force, right? So our immune system also has different types of cells. And the cells at the FPIES reaction, we think mostly it's called T cell mediated, and so therefore it's delayed, versus a peanut allergy that happens immediately when you eat the food and you get the hives or the vomiting or other consolidation symptoms. It's IgE driven, which is immunoglobulin E, another mouthful, but more immediate, minutes to 2 hours. The T cells take a long time to get activated, and that means 2 hours. At the shortest, I'd say 1 hour, but usually it's 2 hours to 4 hours, and sometimes even longer. So that's why it takes so long to get diagnosed, is because it takes so long to present.
Yeah. And, you mentioned obviously some common food triggers, which we'll get into. What are the hallmark symptoms of an FPIES reaction? Obviously, knowing that it is a little bit more delayed, like you're saying, it could be 2 to 4 hours or more. What would a parent kind of look out for after ingesting a food? And they may not know because it's happening hours later.
Yeah, I would say the biggest, most common symptom is vomiting. And it's not just one vomit. It's not just like 2 vomits. It's like continuous episode after episode. Like you think you're done, and then it can keep going. It can be 4 times, 5 times, 6 times, to the point where it's almost, the child is throwing up vomit that's bile colored. And it can be kind of concerning. Simultaneously, you can also have diarrhea, not always present, but can be present. And the loss of all of this fluid from the top and from the bottom leads to dehydration. And so you can also see effects of dehydration where your child is more a little limp, not active, doesn't look well, can get pale from the loss of fluid. So sometimes people can mistake it for a viral infection involving the stomach. So you can think of the stomach bug. It can also be mistaken for shock.
I was just gonna say, I'm like, I think this is a good segue to ask, obviously, like, that could be obviously the reason why we see delays, because it can mimic other things that can happen commonly in children, like you said, like a stomach virus, or like, oh, sometimes kids vomit when they're trying new foods because it elicits the gag reflex, or it's reflux if a child had reflux in infancy. So Taylor, I am going to jump to you. I'm curious, like how it presented, and it could have presented differently in both in the two children that had it, and also kind of what it was misdiagnosed as initially.
Yeah, so my first one was actually misdiagnosed as an IgE allergy,
Okay.
because we were wondering if it was some sort of allergic reaction, and so we went to an allergist that saw all ages, which is my first regret. I wish I saw a pediatric allergist because I feel like they didn't have a ton of knowledge in FPIES. But her skin prick did show positive for eggs, which was her reaction. But because skin pricks aren't always like the most reliable
Yeah.
test, he was like, oh, maybe it's just like a weird presentation of IgE and so delayed. And then later on, we saw a pediatric allergist at our local children's hospital. And she was like, no, that sounds really like a lot like FPIES.
Oh,
So that's how my first one was misdiagnosed. And then second one, I knew right away. Like I suspected right away. And then we trialed the food and it was a reaction. And then my third one actually got a stomach bug. And I had seen FPIES so many times and I was like, dang it, it's happening again. But it ended up not being FPIES. It was just a stomach bug. So it's
yes.
really
Oh,
easy because kids puke all the time, especially if they're
yes.
in daycare. And I feel like as an FPIES parent, like once you have a kid who's diagnosed, or even with the same kid who throws up, you're so tempted to be like, oh, it's another trigger food. It's another kid with FPIES, which is why it's so important to get like an outside perspective from an allergist or your pediatrician who knows a lot about FPIES to help you like parse out whether or not it's actually a reaction or not.
Taylor, did you think that there was a difference? Sorry about jumping in, between the vomiting with the FPIES reaction that your other child had, and then the younger child having the stomach bug. Did
Yes.
you notice? Can you comment on that? Yeah.
Yeah. So my with my daughter, because it was delayed, it actually happened like at night. And
Mm.
so by the time I got into her room, she had already thrown up. But with my son, when we trialed the food, this is actually a funny story. So it was 4 hours, and in my head I was like, if we make it to the 4 hour mark, like we're probably good. And so my
Yeah.
husband had him in his arm and was like, yay, and was like dancing up and down like we made it. And as he was doing that, he
Oh,
like projectile
Oh
vomited
my
like
and
gosh.
like it
no.
launched out of his mouth. So
And
it's
this is
definitely
the
more
child.
forceful.
That was the child that had the virus, right? The one that you're
Yes.
saying when you
No,
made
no,
it to
that
the
was the
4 hour.
child with
Oh,
FPIES, the
oh, the
second
second one.
the second
Gotcha.
one.
I see. I
Yeah.
see. Okay.
So with it was more projectile. My kids FPIES was mild compared to some others. Like Dr. Relan said, it wasn't like dehydration or requiring an ER visit, but we also had a plan because we suspected FPIES, so we did have Zofran on hand and we administered it right away to help prevent any like excessive fluid loss. So
Oh, very no. This is so useful because I've had maybe as a general pediatrician maybe seven that I've diagnosed, like meaning I've personally walked them through it, and a lot of it is again I all of them have had the vomiting. Manisha, is there any chance that the vomiting isn't part of the clinical symptoms? Right. Okay. That's what I thought because all of them had vomiting. But interestingly, the reason it got put on my radar is not even from medical training because I trained back in like the 2009, 10. We learned a little bit about FPIES, but I feel like it became more common now. I don't know if Manisha, you're seeing that too, but I had a really good friend whose son had FPIES, and I listened to her experience, and from then is when I was like, was I missing FPIES all these years? But no, I think I didn't. But it was like it really put it on my radar, and then after that, I was like quickly diagnosing ones like that were like, I think this is not it, and I felt like a hero for a lot of these parents because they were going down to other pediatricians who were like, oh, maybe it's just maybe it's just a virus, maybe it's this. I'm like, it seems a little bit unusual. And like you said, Taylor, a lot of those middle of the night vomitings, like meaning they'll eat dinner and then they'll go to bed and then they'll have the vomit, and they're just happening too frequently for it to be a coincidence. And
right.
it wasn't always the first time. It was like one time and then the next time, and I'm like, there's no reason why your kid who did not have any other reason to have this would all of a sudden start vomiting, out of the blue. Was there certain foods that were the triggers when you when you got that diagnosis, Taylor?
Yeah, so my daughter was eggs, which she only had like the whole eggs. So like
Mm-hmm.
some HepBIES kids who react to eggs can have eggs in baked goods and some can not. And so my daughter could have like a cake with eggs in it, but she couldn't have scrambled eggs or hard boiled eggs. So hers was actually really easy to manage. My son was wheat, which was so hard because they
Yeah.
had like family style meals at his daycare. And it
Yeah.
just killed me that all of his little friends could sit at the table and he had to be strapped in so that he didn't go and like take his friends, like
Wheat,
toast or
yes.
whatever. And then like the teachers, I had to be like, you really got to like sweep up the crumbs. Like it's so much that you don't think about.
Yeah.
Like I'm like training the teachers, like sweep up the crumbs after every snack and wipe down the table so that like he's not grabbing somebody's goldfish. And it was really hard. It
It
was really
is.
hard.
And I want to dive in deeper to that because I know that's obviously how you guide families too, from the personal
Yeah.
experience, but also just like how to navigate the food choices and all of that. Manisha, my question for you before I flip it over to Taylor with more questions there is how is the diagnosis made? And Taylor even mentioned too that skin prick tests don't really work for this. So how is that diagnosis made and why don't skin prick tests work like they would for, other food allergies?
Excellent question. So, skin tests don't work because skin tests look at IgE mediated food allergy, and this is clearly a delayed reaction. So, it's a different immune pathway. The problem is that some allergists, myself included, we will do a skin test because there is something called atypical FPIES,
Mm.
where you can have both an IgE mediated reaction and a T cell mediated reaction to the food. And it's rare. It can be up to 25% depending on the studies you look at for the incidence. Thankfully, it's not very common, but it's based on history. It's literally based on being like listening and asking questions and asking your parents to keep a food diary, a food log of what's going on and what did they eat, what were the activities. So just a lot of thorough history and exam.
And do we know why FPIES occurs? I mean, from the current data theories, I know the area of food allergies and allergies in general, like this, is so fascinating to me as a general pediatrician. And I know obviously it is to you too. That's why you're in
Yeah,
the specialty.
yeah.
But do we know why? And any data on is there real incidence increases? Is it certain countries? Like anything that you can add? And obviously, I understand if there's nothing that is there right now.
Yeah, I would say in general, all
Hmm.
food allergies are on the rise,
Yeah.
whether it's IG mediated or non IG mediated, like FPIES. So I myself, in the last 10 years in practice, have been seeing an
Yeah.
exponential increase and quite a lot. In fact, and I wanted to mention this too, I'm not the only one that helps manage FPIES.
Yeah.
Sometimes GI colleagues, so the gastroenterologists, can also manage depending on where you are in the community across the country. Some pockets of GI docs feel more comfortable because it's such a delayed reaction. It's so heavily in the presentation
Gut.
of vomiting, right? So you
Yeah.
may not end up in an allergist's office right away. So it's just, and I don't know if maybe the GI is seeing more as well in their experience, but we don't know why exactly, Mona. Everything, all of the conditions are on the rise.
Yeah, I'm very interested too. Obviously, anytime there's a research study or conference, I like make a beeline to two things. I mean, I love everything, but I'm always interested in autism research just because I find it very fascinating, and then also anything in the allergy world. And so I'm always going to be seeking out my allergist immunologist colleagues to help me stay up to date on all of this information. And Taylor, going to you now. I know obviously, thank you so much for sharing your personal story and the how it was diagnosed. What do you wish parents and clinicians would know about FPIES, having gone through the experience you have as a mom of two kids with it?
Well, I think there's two separate buckets. I wish pediatricians had more of like a general knowledge
Mhm.
of it, because I find that there are some that are like super up to date with like the food allergy stuff and FPIES, and then some who like have never heard of FPIES or like
Yeah,
have never diagnosed it, and it can be really frustrating to like have your kid have these vomiting episodes that are really stressful and scary, and it's just, oh, it's just a stomach bug, without like more digging. So so I hope this podcast maybe will like reach a lot of ears and help
yes,
raise awareness, because I find even like on my Instagram post when I share about FPIES, like every time I do that, I get at least 1 to 2 comments that say like, I took this to my doctor and we got a diagnosis. And so I think awareness like this is really important. It really makes
Absolutely.
a difference. And parents, I wish that they knew that it's important to get a knowledgeable provider in on the care. If you know your pediatrician isn't familiar, get in with an allergist or a gastroenterologist. And then if you're struggling, especially with solids introduction, a dietitian can be really helpful with that. But definitely getting support is so important, which I know is easier said than done
Yeah.
because sometimes wait times can be like crazy long in some places. So and then my other tip is don't go looking on Facebook groups for information because Facebook groups, like some of the advice I had to leave because I was like, this is not helpful.
Is this like general groups or FPI moms groups or
FPIES groups.
even those groups? I was just going to ask. Okay,
Yes, I
what do you
see
feel like was worrisome or like anxiety
like
provoking? Yeah.
asking questions about like, is this a reaction?
Mm,
And a lot of people will be like, yes, yes, yes. And then that food is eliminated from the kid's diet
mm.
when like they really need to be evaluated by a medical professional because what if it's a stomach bug? And now we have one less food that a kid with an already restricted diet is eating. Or like I even saw like you can only introduce like one food every 3 days or one food a week when you have FPIES. And so this kid already has
Oh,
a very restricted diet and now we're
yeah.
restricting heavily.
Yeah.
And kids with FPIES can still like do solids introduction, like and introduce new foods on a regular basis. They don't have to have these like long delays. There are like higher risk foods and lower risk foods depending on their trigger foods, but they can still continue to introduce solids. So I see like parents looking there for information because they lack support because it can be hard to find a provider. And then we have unnecessary restriction of the child's diet, which can have a lot of consequences. So
Yeah, I very interesting about the Facebook groups because I joined one when my son had a stroke when he was born and he had seizures.
yeah,
So I joined one and I left probably in like a week because of the anxiety it caused me. Like it was very, you would
no,
think that that would be very supportive, but it wasn't. And so I was just curious if it was after the diagnoses or just a general group because I could imagine a general group being even worse. Like, oh no, my kid vomits all
right,
the time. Like kind of like dismissive
right,
of like, no, this isn't real. I'm
no.
curious. Did you end up seeing a GI doctor as well, Taylor, or was it the allergist? Because I know you obviously with both the children, you had different stories a little bit because of your awareness after the first.
Yeah.
But who did you end up seeing for the
Well,
care?
with my first one, we saw an allergist. And
Hmm.
then with my second one, he actually started with cow's milk protein allergy. And so
Mm.
he had a lot of GI issues to begin with. And so we were already with his GI doctor. And I was like, hey, guess what? I'm pretty sure we have something else going on. And so we continued to see her. And then we also got an allergist on board too, mostly to plan, talk about the reintroduction and like medication management. So the prescribing of the nausea medication. So we had both for my second one. And then the third one, I did schedule with the same allergist because I was freaking out that I had 3 FPIES kids, but it ended
Yeah.
up not being a reaction. So that was good.
And I do have more questions about obviously how to approach those meals and introduction of
Yeah.
solids and all of that. But before we do that, Manisha, how do we determine which foods to avoid? Like so just say like Taylor's example, right? She had the egg concern and maybe at that point she didn't know. What are the steps into figuring it out given that you're not doing skin prick tests or anything like that to figure out where to start with the food avoidance?
Yeah, well, the most common foods are cow's milk and soy when it comes
Mhm.
to the early infants. And then when it comes to solid foods, it's usually cereal grains is the most common. And then but any food, it can be vegetables, it can be fruits, it can be egg, as Taylor mentioned, and seafood even. So I've also seen it to peanut. I mean, I'm a specialist, so I see a lot of rare and uncommon things. Once we know the trigger food and based on history, and sometimes a food diary, and sometimes we don't know right away, and we have to do challenges and reintroduce, and we walk through that. We look at what are the most common foods, and we know what the most common solid food triggers are. We look at what's in the same shared family. So cereal grains, what reacts rice and oat. If you're allergic to rice, you're probably, or having a reaction FPIES to rice, you may be also similarly affected with oat. So maybe we'll delay the oat. Maybe we'll work, toward introducing buckwheat first or quinoa first, and less reactive foods. And so it really is individualized, which is why seeking that medical professional who knows FPIES is really important.
But you can continue to introduce solid foods. You don't have to stop introducing the variety.
Oh my gosh, did you see me shaking my head?
Yeah.
I was trying not to
Especially
shake
when you were saying about the week delay. And so,
we don't need to do that.
So this is a great segue, because my question is, there is a lot of already without any food allergy, right? Meaning if there's no food allergy, FPIES, I already know this, that parents have a lot of anxiety about the introduction of solid food time. Meaning, do I do puree, baby led weaning? What if the kid doesn't eat? There's so much other anxiety around eating. And then you, of course, add the concern of a fear of allergies that I see, but also once there is a diagnosis of something like FPIES. So Taylor, how do you help, or how can we help parents sort of navigate that anxiety about introducing new foods, and maybe clarifying again some of the misconceptions or mistakes you see people making? This is for people once they have an FPIES diagnosis.
Yeah. I find that parents like lists. And so we have like high risk, moderate risk, low risk, like lists from the literature. And so I think that's comforting to be handed that. So like if the kid has had, like Dr. Relan said, like an allergy to like rice. Okay, now we know certain for sure high risk food, and then we have other like just general high risk for FPIES food. So like if we're really nervous, like let's prioritize a high iron food in the low risk category and introduce a couple of those things to keep the variety going. And once we get confidence up, we can move to the moderate risk. And then of course, making sure that we have a plan for a reaction from the provider, like what to do, what to look out for, when to administer medication, when to go to the emergency room if necessary. But I think the list is really helpful.
I agree. And I would also encourage that you will forget to talk to your doctor when you're in the visit with your questions. So reach out to them after. I mean, write them all down. And these Facebook groups, I joined one as an allergist just to see what was in my community. I didn't even last that long. I got such anxiety, as well as just a professional reading what other folks felt comfortable telling advice without knowing anyone's full history, and me thinking, oh my gosh, what if it's not necessary? And you don't need to wait. There is a chronic form of FPIES. Let's acknowledge that for a quick second, because I know there are some people that will not react for a very delayed amount of time. That is very rare. So for most FPIES families, it is not important to stress about the fear, because that will overtake you. Keep a journal. Just keep a journal. That will give you so much more control and power, because if you're tracking the foods, we'll track the symptoms. We will find it if we know exactly what's going in the baby's body.
And Taylor, do you feel like, I mean, you obviously have experience being a dietitian. Do you feel like some of the families that you've seen that have dealt with that, like, do you feel like it would behoove them to have a nutritionist or dietitian with them through this process? Or did you get another dietitian helping you too? Like, I was just curious, like, because, obviously I know, but sometimes when it's your own kid, you're like, hey, do I need extra? Because you already said it perfectly, that I think there could be a misconception that, well, my kid's going to be nutrient deficient, right? That I can't create these nutritious meal plans. And it's hard when you think about, I have to restrict certain foods, but how can they get that list and sort of know that? Would that be, obviously, I don't think allergists or GI doctors are well-versed in that compared to a nutritionist.
Yeah, I mean, I think the list is like from a very well-known FPIES article. I can send you the link if you want to post it, the scientific article with this podcast. But yes, I think it's very important for some families to utilize the dietitians. I don't think it's necessary for all. It depends on the family. It depends on how much guidance that they need. But if the parent is struggling with because these kids who have FPIES still need to prioritize the other things with starting solids. We still want to see prioritizing iron. We still want to see prioritizing like omega-3s and lots of fats. We want to explore lots of different produce with fiber. We want to get like textures in. So if the family is afraid of which totally justified because allergic reactions are scary. But if the family is afraid of like introducing new foods, so we're really holding back on where we're eating, what we're eating, that's the point where you need to get additional support, because like introducing these allergens is still important for reducing IgE risk. So like
Yes.
if the kid has FPIES and we're like, I'm not going to introduce any of the allergens, now we're increasing
Mm.
the risk for other types of allergies. So we still need to manage like the FPIES, but there's other things that are important for just starting solids in general that also are important for that kid too. And if that's just too much to keep track of and put together, or it's too stressful, that's when getting a dietitian who is like a pediatric dietitian who is experienced in starting solids and FPIES like myself can be really helpful to guide you through that.
Did your children, because of the FPIES, obviously having to, curtail menus and all that, did you tend to see more selective eating? I know it's not always the reason why someone may be picky or selective. And if so, or if not, how would you manage sort of the picky eating tendencies that children may have with FPIES?
Yeah. Yes, the kid who has the wheat allergy is my pickiest eater. I don't. I'm sure it was a combination of things. I
Yeah,
don't
I mean,
think the FPIES
it's not going to be one
helped.
thing, right? Right.
Yeah, and I don't think the cow's milk protein allergy helped either. Like it was all a
Hmm.
combo of stuff. But we do know that FPI, like if a kid has an adverse reaction to food, that can increase the risk for ARFID, because like
Yeah.
if it's a traumatic reaction, the kid can start to become picky. And if we head down that road to where we're heading into like extreme picky eating, extreme limiting of the diet, we can be in like eating disorder, pediatric feeding disorder territory, which with FPIES, it would probably be more the pediatric feeding disorder world. But the management is the same thing that we would do for a picky eater who doesn't have FPIES. We want to work on like low pressure exposure, making it fun, lots of texture introduction. We can do low pressure food exposures away from the table so the child doesn't
Yeah.
feel like pressured to eat. And then if it's ever like a super stressful situation, you're always worried about food, getting a dietitian or a feeding therapist involved, because FPIES often presents in infancy, like by the 7-month-ish point, that's also a sensitive period for texture introduction.
Yeah.
So if we're not getting texture introduction by like 9-10 months, we're increasing risk for texture aversion later on down the road. So it's all like a lot of things to do at once, and FPIES just makes it way
Yeah.
harder. And so don't hold back on getting the support. And even if you're like, I might need it, get on the waiting list, because sometimes feeding
Yeah.
therapists can take a while to get into. So talk to your pediatrician, ask them to get you on a waiting list. And like if the time comes and you don't need the appointment, you can cancel.
I love that, and we'll get into more of that kind of final message I would have from being a Gen Peds as well. And then Dr. Taylor did allude to ARFID, avoidant restrictive food intake disorder, which is actually something we're going to have a entire podcast episode about, me and her. So stay
Yeah.
tuned. We didn't have time to record it right now, but we are going to do that, me and her, because that's another thing I get a lot of questions on, how that differs from picky eating, quote unquote, and how it's not
Right.
just picky eating, it's so much more.
Yeah.
And then Taylor, my other question for you is, you talked about obviously being a mom and having to do the communication with the daycare and like the wheat, the crumbs and all of that. What are some other practical tips for families dealing with social situations like daycare, school, or family gatherings? And I know how hard this must be,
Yeah.
obviously not personally going through it, but hearing it. I mean, already there's so much stress with everything else we do as mothers and fathers and caregivers, but then now adding the, is my child safe to it, right?
Right.
So what would be some practical tips? And it might involve lists,
So
which I love.
yes.
Yeah.
So first, if it's like a daycare,
Mhm.
like get in there and ask to train the teachers.
Yeah.
And you don't have to be an allergist or dietitian to train the teachers. If you are a mom and your kid has FPIES, you know way more than the general population. Or if you're a parent and your kid has FPIES, you know way more than the general population. Get in there, explain to the teachers what FPIES is, what's going to happen if they have a reaction, why it's important to be careful, and what they're allergic to. And like you got to clarify, like if it's, they're allergic to grains, which grains, where
Yeah.
do you find them? Because if you say, oh, my kid has like a rice allergy, FPIES rice reaction, like it's not just rice itself. Rice is in teething crackers, rice is in puffs, rice is in chips, rice can be in noodles. And so you have to like give a list of where these common foods are if you're not the one preparing the food. Second is like think about when they're toddlers, food sharing. How can we mitigate that? How can we stop that? Maybe the toddler needs to be in the high chair for longer. Maybe we need to have a separate table. Like there's got to be some way, because a lot of daycares will eat family style.
Yeah.
There's got to be some way to prevent the kid reaching over and grabbing like a sandwich from their friend's lunchbox. And then be prepared to like send in food, bring lunch boxes, bring snacks, bring the allergy free cupcake to a birthday party everywhere you go. Like I packed snacks always, because you never know when you're going to be in a situation where it's going to be snack time or food, you're going to stay out longer than you thought. And having those safe foods on hand is really important so that you don't feel like you're stranded without something to feed your kid. And it also feels less sad. Like it feels less sad to give your kid the allergen free cupcake than for them to have no cupcake. It's really hard as a parent to like see your kid strapped in or see your kid having the different cupcake, but like having those alternatives can make it a lot easier for you.
And inclusive. Yeah, no, absolutely. Because I could imagine, especially the birthday party or the, cupcakes at a birthday party. I mean, every kid is eating it and excited about it, and it gives them a chance to feel part of something, but keeping them safe at the same time.
And one more thing I would add is like announce it and tell everybody. Like teach your kid to say, I'm allergic to wheat.
Yes.
Like tell the host, hey, just so you know, so-and-so is allergic to wheat. Here's what this means. Here's what they can't have. Yes, I need you to prepare something different. I'm going to bring something ahead of time. Like just let them know everything, but also teach your kid once they're toddler age, if they still have the FPIES, to say, I'm allergic to wheat, or like an allergy band. If they can't say it, something along those lines.
Yeah.
I was going to say, when I counsel my patients or in the office, I say, what is in your control? I always ask the parents to come back to that, because I feel like that helps me ground me. Mm-hmm. So there's so many things that we cannot control. We can't give into that fear, but we can control education and being prepared. And that's kind of what you gave a beautiful like list of things that the parents can do. The biggest thing about education is that there's not enough time in the doctor's office and the doctor's visit to teach you every single detail. A lot of my visits run late because I like to over-educate, perhaps.
I love it. I know.
It's
the healthcare system, not us.
It's so true.
Let's remember that.
Also retaining information. Like, you're a human being who's never heard the food protein enterocolitis syndrome before. And so how are you supposed to remember all those words and write them down frantically? So I always recommend asking your doctor for any resources so that you can further educate yourself and be prepared. There's actually like emergency action plans online already there, great websites, a note for the emergency room, a note for daycare. Like, people have done this.
Yeah.
You're not alone. So ask us to direct you to resources, and I'll share some with you, Mona, to add to the show notes, some of my favorite websites.
I love it. And like we talked about already, I hope an episode like this is awareness and education for people who are like, is it or is it not? But also people who have their kids have FPIES and they're like, I have felt so alone and I'm on this Facebook group and they're telling me to introduce this or not. And now I don't know. And then also for pediatricians. And, like I had mentioned earlier, I was not very aware at all until it was my friend who had a son with it. And I was like, what is this thing? I need to know about this. And then ever since then, I was like, I could learn even more about it, maybe, obviously be even more aware of what it is, but it's definitely on my radar. And I know colleagues who are still practicing that are like, oh, yeah, is that very common? I'm like, I see it. So yeah, we should know about it. We definitely should know, even if it's not super common. But it is something that we are seeing the rise of, like you said. And Manisha, I would love to, kind of wrap up with you also about what is the long-term outlook? I know you had alluded to the fact that there is a chance of outgrowing. How can, visits look like in terms of reassessing for reintroducing foods, or, how does that process look like for families?
Yeah, and I will tell you right off the bat, most often FPIES has a very favorable diagnosis and outcome. Most FPIES is outgrown around age 3, sometimes as early as 12 to 18 months after the initial reaction took place. So I've seen some kiddos outgrow it before even age 3. Sometimes it happens as a happy accident. It has to be something that we talk about, because I alluded it's a syndrome. So when I guide people on reintroduction, I have to know what the actual earlier symptoms and presentation looked like in terms of, are we going to do this at home, or would you be better suited in a clinic with an IV access already obtained before you get too dehydrated to the point where I'm not going to be struggling to get meds and fluids into you. So in my fellowship, that's how we used to do it. We used to do a 1-day hospital stay, and in less than a day, really. But we could also check labs and monitor. for the delayed reaction. So most foods are outgrown. The adult foods, the later foods are like the seafood, so shellfish, fish, and egg. So if you develop that in late childhood or adulthood, it's less likely to be outgrown, just like most IgE food allergies that are also developed in adulthood are less likely to be outgrown. So overall, very favorable, and most tolerate the food again. So.
And in case we get this question, which of course I wish people could ask questions as we do these podcasts, but I think a common one that would come up is there is no treatment per se, right? Obviously, they're outgrowing it on their own, but there's no like immunological therapies or things that are given to the child. It's just time.
Supplements.
Yes,
Yeah.
no supplements. Like I think it's really important. Is there anything that they can do besides going to an allergist, waiting this out, reintroduction of food, following that they can do?
I think I would just like to reiterate no.
Good. Okay. This is really helpful. So that if they're on the Facebook group and they're like, oh, take this, this combination.
No.
Because I know there's probably in the next couple of years, there'll be some fear-based marketing on some supplement, like you said, Dr. Taylor, that's like, oh, if you have FPIES or food allergies, take this. And I'm very concerned about that. So
don't waste your money.
Yeah.
Buy yourself some chocolate and flowers and move on.
Exactly. No, the most important thing you can do for your child is diet diversity.
Okay.
Like honestly, encouraging them to eat from all food groups, getting their probiotics, getting their other nutrients, and making sure they're healthy in every other way you can control. That is more important. And I would say there's symptom management. So I have met patients of other providers who were diagnosed with FPIES but didn't have an actual plan in terms of what to do when the symptoms develop. So that is like frustrating. There are, as Dr. Taylor also alluded to, medications out there, antiemetics, medications to help your child stop vomiting so they don't get dehydrated. Really important to ask for that.
Dr. Manisha, do you feel that from Gen Peds or from a fellow allergist as well?
I got it from fellow allergists.
Okay,
and I was like, what in the world?
Is there a way that a family can know, besides obviously talking to their general pediatrician, that there's an allergist that is more aware in FPIES versus not? Like, is there I don't think there's obviously no certification or anything like that, but how can they know that their allergist is well-versed in this topic?
I have a thought, and I think Dr. Taylor hit that on the head, which is pediatric.
Yes.
Board certified pediatric. Making sure that they're a pediatrician trained first. So we are very well versed in all presentations of most common, kid things.
Very good to know. Yeah. Well, I love that because I agree. There's so many experts, right? But not everyone is an expert at important things like this. And so, I think, I want to ask you both your final messages for everyone listening. And one of my final messages would be that sort of advocacy piece. I hope people listen to this and understand like, hey, my kid has been having this happen, or maybe they'll listen to this and it will happen and they'll be like, wow, now I know. And I hope that you take this information to your general pediatrician. If your general pediatrician you're not feeling like they're well-versed or they're not listening to you and you're like, something's not right, you can either see another clinician at that practice or self-refer or ask, hey, I appreciate you, but something is not sitting right with me. Do you have a pediatric allergist that I can see to talk to? And then we can kind of touch base from there. I can't stress this enough, but your pediatrician, like the general pediatrician, should be on your team to figure out what is going on if you are concerned. My philosophy as a general pediatrician is letting go of ego. I think a lot of my colleagues have ego, which I don't understand. But if a family member or if someone's coming into me and they're like, I believe you, but something's not sitting right, I will do whatever I can. Referral, blood work, imaging to reassure, because sometimes parents need that. And so even if you're feeling like, I don't know, I don't want to inconvenience someone. This is your kid. Please know that you need to advocate for them. And the worst case is that, or the best case is that it's nothing. And, you got evaluated, but you want to get this stuff early intervention. And like Taylor had mentioned, with introduction of solids and then the avoidance of foods, I want to make sure that you have the right plan so that you're not avoiding things unnecessarily because you read it somewhere, and that you're also addressing issues like picky eating and things like that, so we can give the child the best opportunity for food and introduction and advancement and nutrients and enjoying the feeding experience, albeit with this allergy and intolerance, I would say. But Taylor, I'll go to you first. What would you say is your final uplifting message for everyone tuning in today?
My final uplifting message, gosh. It's the first time you hear about FPIES will be overwhelming, but you will be a pro in no time. You will be shocked with yourself at how soon you become a pro at food allergies, at FPIES, and managing. You'll be telling everybody about it, educating the world, and maybe you'll help somebody else get their
I love
right
it.
diagnosis. But it comes faster than you think. And also, I want to encourage parents that, like, if you need support, like if you need the support of a therapist, if it's so stressful to you, don't feel like that's just this crazy thing. It's not. Like, having a kid with allergies is hard. And that might be a crucial component of this journey, is you getting your own support as a parent. But you can do it. It's doable. It's hard, but it's doable. And you'll be a pro in no time.
Yeah. You'll know more than the doctors, and that's good. Like,
Yeah.
that's like, I knew so much about stroke and seizures. I mean, I was a pediatrician, but you will know, and that's awesome. And it's okay to say, "Hey, I learned this." And I'll be honest, I learned so much from my FPIES patients, my patients with parents, kids with cerebral palsy, like any issue that I'm seeing in this world. I love being able to ask my families, like, "Hey, what is something, what happened at the specialist?" Or, what is
Right.
something that you wish I wouldn't have known? And I wish a lot of my colleagues would do that, because it is so much growth for us to be able to be better for the next patient who may have that issue. And so I love that, Taylor. What would you say, Manisha?
I would say that always be prepared and not scared. Like, it's easy to fall into the fear part of it. And even I don't know everything. So if you need a second opinion, I have a list of board certified allergists that I trust in my community. Ask me and I'm happy to give it to you. But I refer patients out if their FPIES is very complicated, if they have multiple solid foods. It's rare, but it happens. And I'm not afraid. I'm in private practice, but I'm not afraid to email an academic physician who is an international expert in FPIES and just say, "Hi, can I run this by you?" And we do it for patient advocacy all the way through and through. So listen to your heart and listen to your intuition on that. In terms of, I know a little pun for Dr. Taylor, but really make sure that you feel comfortable. Your questions have been answered. Don't be afraid to ask more questions after the visit ends. Know where your reputable resources are, because I think there's so much misinformation, misguidance with supplements, as we alluded to earlier. So we're going to drop some good websites for you to access some of that. And find a pediatric allergist or a pediatric gastroenterologist. Like, that's what we're here for. Get a second opinion if you need one.
And I will be dropping those links. That way you all have them. Manisha, where can everyone go to find you, your social media channel, if you can tell us that?
Yep. I am Peds Allergy MD on Instagram.
Thank you. And Taylor?
I'm growing intuitive eaters on Instagram and YouTube, and then I'm Dr. Arnold on TikTok. And I will send you a link. I have a whole longer video of, like, the long story of our FPIES journey and allergy. So I'll send that to you too.
Thank you. Yeah, I'm so glad that we can put all that information so everyone feels less alone and feels, again, empowered, prepared, and not scared. I love that, Manisha. That is so helpful. Thank you both. I will be attaching their Instagram, social media handles, Instagram, TikTok, for whatever we have here, so that you can check them out, stay up to date. Obviously, they're a wealth of information in their specialties, and obviously Taylor having gone through the personal experience as well. And thank you both for joining me. This was an amazing conversation. I felt that it was so needed, and I was right on that this was a perfect idea to have the three of us on, and I'm just so glad that we could do this today.
Yeah, this was fun.
Thank you. Thank you for having us.
Of course, of course. I'm sure there'll be other topics to have a 3-for-1 again. But thank you. And for everyone tuning in, again, if you love this conversation, if you found it helpful, please comment below, hit that thumbs up sign, and also subscribe, because this is how the channel continues to grow, so that we can have more amazing conversations that educate and empower you as caregivers. So thank you, and I will have another guest next time.